Question 1. Analysis of the reprocessing of a reusable anesthesia breathing circuit, which has been used for a patient undergoing a routine elective procedure, requires the anesthesia technologist to select the most appropriate infection control measure. Considering the potential for contamination with respiratory secretions and the need to prevent pathogen transmission, which of the following approaches best aligns with current regulatory frameworks and best practices for anesthesia equipment? Option A. Cleaning the breathing circuit with a standard hospital detergent and allowing it to air dry before reuse. Option B. Low-level disinfection of the breathing circuit focusing on external surfaces. Option C. Visual inspection of the breathing circuit for gross contamination, followed by rinsing with sterile water. Option D. High-level disinfection or sterilization of the breathing circuit according to manufacturer's instructions and established guidelines. The correct answer is D. High-level disinfection or sterilization of the breathing circuit according to manufacturer's instructions and established guidelines. Explanation. The scenario presents a common challenge in anesthesia practice, ensuring the highest standards of infection control when dealing with reusable anesthesia equipment. The professional challenge lies in balancing the need for efficient patient care with the absolute imperative to prevent healthcare-associated infections. This requires a thorough understanding of established protocols, regulatory guidelines, and the specific properties of anesthesia equipment. Careful judgment is crucial to select the most appropriate cleaning and disinfection methods that are both effective against pathogens and safe for the equipment and the patient. The correct approach represents best professional practice because it aligns directly with the established guidelines for infection prevention and control in healthcare settings, as mandated by regulatory bodies overseeing anesthesia technologists. Specifically, it adheres to the principles of high-level disinfection or sterilization for critical and semi-critical anesthesia equipment, which are designed to eliminate all microorganisms, including bacterial spores. This rigorous approach minimizes the risk of pathogen transmission between patients, thereby protecting patient safety and upholding the ethical obligation to provide care that does not cause harm. Adherence to manufacturer's instructions for reprocessing is also a critical component, ensuring equipment integrity and efficacy. An incorrect approach that involves only low-level disinfection for semi-critical equipment is professionally unacceptable. It fails to eliminate all viable microorganisms, leaving a risk of transmission for pathogens that require more stringent inactivation. This directly violates regulatory requirements for reprocessing semi-critical items, which are defined as items that come into contact with mucous membranes or non-intact skin. Another incorrect approach, such as relying solely on visual inspection without validated cleaning and disinfection processes, is also professionally unacceptable. Visual inspection alone cannot guarantee the absence of microorganisms, and this method neglects the fundamental principles of microbial inactivation necessary to prevent HAIs. This approach is a clear failure to meet the standards of care and regulatory expectations for infection control. The professional decision-making process for similar situations should involve a systematic evaluation of the equipment's classification, critical, semi-critical, or non-critical, according to established guidelines. This classification dictates the required level of reprocessing. Next, the technologist must consult and strictly follow the manufacturer's instructions for use and reprocessing for each specific piece of equipment. Finally, the technologist must ensure that the chosen cleaning and disinfection agents and methods are appropriate for the equipment materials and are effective against the likely spectrum of pathogens, in accordance with current infection control guidelines and regulatory mandates. Question 2. The assessment process reveals that a critical component of the anesthesia delivery system is exhibiting intermittent functionality during a simulated patient scenario. The technologist recognizes the potential for serious patient harm if this malfunction were to occur during an actual procedure. However, the standard protocol for equipment repair and validation is a multi-day process involving specialized technicians and extensive documentation, which would significantly impact the availability of equipment for scheduled cases. What is the most appropriate course of action for the anesthesia technologist in this situation? Option A. Inform the supervisor of the malfunction but proceed with using the equipment for the remainder of the assessment, assuming the intermittent nature poses minimal immediate risk. Option B. Immediately remove the malfunctioning equipment from service, report the issue according to established protocols, and initiate the documented repair and validation process. Option C. Attempt a temporary, non-standard adjustment to the equipment to restore full functionality for the duration of the assessment, with a plan to address the repair later. Option D. Continue to use the equipment for the simulated scenario, making a mental note of the malfunction to address it after the assessment is complete. The correct answer is B. Immediately remove the malfunctioning equipment from service, report the issue according to established protocols, and initiate the documented repair and validation process. Explanation: scenario analysis. This scenario presents a professional challenge due to the conflict between immediate patient safety and the established protocol for equipment maintenance. The technologist is faced with a situation where a critical piece of anesthesia equipment is malfunctioning, potentially impacting patient care, but the approved repair process is time-consuming. The ethical imperative to ensure patient safety clashes with the procedural requirements for equipment validation and documentation. Careful judgment is required to balance these competing demands without compromising either patient well-being or regulatory compliance. Correct approach analysis. The correct approach prioritizes patient safety by immediately removing the malfunctioning equipment from service and initiating the documented repair process. This aligns with the fundamental ethical principle of do no harm and adheres to regulatory guidelines that mandate the use of properly functioning equipment. By following the established protocol for reporting and repairing faulty equipment, Technologist ensures that the incident is properly documented, that the equipment is thoroughly assessed and repaired by qualified personnel, and that it undergoes appropriate post-repair validation before being returned to service. This systematic approach minimizes the risk of recurrence and maintains the integrity of the anesthesia delivery system. Incorrect approaches analysis. One incorrect approach involves attempting a makeshift repair without following established protocols. This is a regulatory and ethical failure because it bypasses the required validation and documentation processes. Unqualified repairs can lead to further equipment malfunction, potentially endangering patients. It also violates guidelines that mandate specific procedures for equipment maintenance and repair, undermining the quality assurance framework. Another incorrect approach is to continue using the equipment while noting the malfunction, assuming it is minor. This is a severe ethical and regulatory failure. Anesthesia equipment is critical for patient survival, and any malfunction, regardless of perceived severity, poses an unacceptable risk. Regulatory frameworks strictly prohibit the use of compromised medical devices, and continuing to use such equipment constitutes a direct violation of patient safety standards and professional responsibility. A third incorrect approach is to delay reporting the malfunction until a more convenient time. This is also a regulatory and ethical failure. Prompt reporting is essential for timely intervention and to prevent other staff from inadvertently using the faulty equipment. Delays can lead to prolonged exposure of patients to risk and can hinder the efficient resolution of the equipment issue, potentially impacting the availability of functional equipment for other cases. Professional reasoning. Professionals in this situation should employ a decision-making process that begins with immediate risk assessment. The primary concern is always patient safety. If equipment is suspected of malfunction, it must be immediately removed from patient care. Following this, the established institutional policies and regulatory guidelines for reporting, troubleshooting, and repairing equipment must be consulted and strictly adhered to. Documentation at every step is crucial for accountability and for ensuring that the equipment is safe for future use. If institutional policies or regulatory guidelines are unclear or insufficient, seeking guidance from supervisors or relevant authorities is paramount. Question 3. The assessment process reveals an anesthesia technologist is monitoring a patient under general anesthesia. The ECG monitor displays a tracing. The technologist observes that each QRS complex is preceded by a P wave, and the rhythm appears regular. However, the technologist is unsure if this represents a normal sinus rhythm or if other subtle abnormalities might be present that are not immediately obvious. Which of the following interpretations of the ECG tracing, based on the provided information, best reflects a competent and safe approach for an anesthesia technologist? Option A. The presence of a P wave preceding each QRS complex with a regular rhythm indicates a normal sinus rhythm, and no further immediate action is required beyond routine monitoring. Option B. The ECG tracing shows a P wave before each QRS complex, suggesting a normal sinus rhythm, But the technologist should also confirm the absence of ST segment deviations and ensure the patient's overall clinical appearance is stable before concluding the rhythm is normal. Option C. The ECG tracing shows a P wave before each QRS complex, but since the patient appears stable and there are no obvious signs of distress, the technologist can assume the rhythm is normal without needing to analyze the P wave's relationship to the QRS complex or other ECG components. Option D. The ECG tracing demonstrates a P wave preceding each QRS complex, which is a key indicator of normal electrical conduction, and this finding, combined with the regular rhythm, is sufficient to classify it as a normal sinus rhythm for the purpose of immediate assessment. The correct answer is A. The presence of a P wave preceding each QRS complex with a regular rhythm indicates a normal sinus rhythm, and no further immediate action is required beyond routine monitoring. Explanation. The assessment process reveals a common challenge in clinical practice: the interpretation of ECG data in the context of patient care. This scenario is professionally challenging because an anesthesia technologist must not only possess foundational knowledge of ECG principles, but also understand how to apply this knowledge to identify potential issues that require immediate attention or further evaluation by a qualified clinician. The responsibility lies in recognizing deviations from normal patterns that could indicate patient distress or a malfunction of monitoring equipment, necessitating prompt and accurate reporting. The correct approach represents best professional practice because it prioritizes patient safety and adherence to established protocols. By accurately identifying the presence of a P wave and its relationship to the QRS complex, the technologist demonstrates a fundamental understanding of normal cardiac electrical conduction. This knowledge is crucial for distinguishing between a normal sinus rhythm and potential arrhythmias or conduction blocks, which could have significant implications for anesthetic management. This aligns with the anesthesia technologist certification's emphasis on competent patient monitoring and the ability to recognize critical physiological changes. The regulatory framework for anesthesia technologists, as outlined by relevant professional bodies and accrediting agencies within the specified jurisdiction, assumed to be U.S.-based for this context, aligning with typical anesthesia technologist certification, mandates a high standard of vigilance and the ability to interpret basic physiological data. An incorrect approach that focuses solely on the absence of ST segment elevation or depression is professionally unacceptable. While ST segment changes are critical indicators of myocardial ischemia, their absence does not guarantee a normal cardiac rhythm or the absence of other potentially serious ECG abnormalities. Regulatory and ethical failures here include a lack of comprehensive ECG interpretation, potentially missing other significant findings like bradycardia, tachycardia, or conduction abnormalities that could impact patient stability during anesthesia. This demonstrates a failure to meet the expected standard of care and a potential violation of patient safety protocols. Another incorrect approach that involves assuming the ECG is normal simply because the patient appears stable is also professionally unacceptable. Patient appearance can be misleading, and subtle ECG changes can precede overt clinical signs of deterioration. Relying solely on visual assessment without a thorough ECG interpretation is a significant ethical lapse and a failure to uphold the technologist's duty of care. This approach neglects the technologist's role in proactive monitoring and early detection of critical events, which is a core competency expected by regulatory bodies. A third incorrect approach, which is to disregard the ECG tracing if it does not immediately suggest an emergency, is also professionally unacceptable. The anesthesia technologist's role is to continuously monitor and interpret physiological data, not just in overt emergencies. Ignoring or downplaying any deviation from a baseline or expected pattern, even if not immediately life-threatening, can lead to delayed intervention and potentially worse patient outcomes. This demonstrates a lack of diligence and a failure to adhere to the principles of continuous patient monitoring and data interpretation that are foundational to the profession and mandated by certification standards. The professional decision-making process for similar situations should involve a systematic approach to ECG interpretation. This includes 1. Assessing the heart rate and rhythm. 2. Identifying the presence and morphology of P waves. 3. Evaluating the PR interval. 4. Examining the QRS complex duration and morphology. 5. Assessing the ST segment and T wave. And 6. considering the overall clinical context. Any deviation from normal should be documented and reported to the anesthesiologist or supervising clinician promptly. This structured approach ensures comprehensive analysis and adherence to best practices in patient monitoring. Question 4. Research into troubleshooting common equipment issues for anesthesia technologists reveals a scenario where the anesthesia machine's integrated pulse oximeter begins to display erratic and unreliable SpO2 readings during a surgical procedure. The anesthesiologist is actively managing the patient's airway and ventilation. Which of the following actions best reflects the immediate and appropriate response for an anesthesia technologist in this situation, adhering to established certification guidelines and patient safety principles? Option A. Disconnect the integrated pulse oximeter and connect a portable pulse oximeter to the patient, bypassing any communication with the anesthesiologist or troubleshooting of the integrated unit. Option B. Continue monitoring the patient without addressing the pulse oximeter issue, as the anesthesiologist is focused on ventilation and may not require SpO2 data at this exact moment. Option C. Attempt to recalibrate the pulse oximeter using the machine's diagnostic menu without informing the anesthesiologist, assuming the issue is a minor software glitch. Option D. Immediately inform the anesthesiologist of the erratic pulse oximeter readings and initiate the institution's approved troubleshooting protocol for the integrated pulse oximeter, which may include checking the sensor, cable, and patient connection. The correct answer is D. Immediately inform the anesthesiologist of the erratic pulse oximeter readings and initiate the institution's approved troubleshooting protocol for the integrated pulse oximeter, which may include checking the sensor, cable, and patient connection. Explanation. This scenario presents a common yet critical challenge in anesthesia technology, a malfunctioning vital signs monitor during a patient procedure. The professional difficulty lies in the immediate need to ensure patient safety while simultaneously addressing the technical issue, all within the constraints of a dynamic operating room environment. The anesthesiologist relies on accurate real-time data for critical decision-making, and a faulty monitor can lead to delayed or incorrect interventions, potentially compromising patient outcomes. Adherence to established protocols and a systematic troubleshooting approach are paramount. The correct approach, which involves immediately notifying the anesthesiologist and initiating a predefined troubleshooting protocol for the specific monitor, represents best professional practice. This aligns with the anesthesia technologist certification's emphasis on patient safety and adherence to established guidelines for equipment management. Regulatory frameworks, such as those governing medical device use and patient care standards, mandate that technologists act promptly and responsibly when equipment malfunctions. This approach ensures that patient care is not interrupted without appropriate oversight, and that the equipment issue is addressed efficiently and effectively according to manufacturer and institutional guidelines. An incorrect approach of attempting to fix the monitor without informing the anesthesiologist first is a significant regulatory and ethical failure. It bypasses the primary caregiver's awareness of a critical data deficit, violating the principle of clear communication and potentially leading to patient harm if the anesthesiologist makes decisions based on incomplete or absent information. Furthermore, unauthorized or unguided attempts at repair can exacerbate the problem or lead to further damage, violating equipment maintenance protocols and potentially contravening manufacturer warranties. Another incorrect approach, such as continuing the procedure while passively waiting for the monitor to spontaneously resolve the issue, is also professionally unacceptable. This demonstrates a lack of proactivity and a failure to uphold the duty of care. It implies a disregard for the importance of continuous patient monitoring and a passive acceptance of a potentially dangerous situation, which is contrary to the ethical obligations of a certified technologist. A further incorrect approach, such as immediately replacing the monitor with a different model without consulting the anesthesiologist or verifying compatibility and proper function, carries its own risks. While replacement might be necessary, doing so without proper communication and verification can introduce new problems, such as incorrect setup or incompatibility with other monitoring systems, thereby compromising patient safety and deviating from established protocols for equipment management and integration. The professional decision-making process in such situations should follow a structured approach. 1. Recognize the malfunction and its potential impact on patient safety. 2. Immediately communicate the issue to the responsible clinician, anesthesiologist. 3. Initiate established, evidence-based troubleshooting procedures for the specific device, often found in manufacturer manuals or institutional policies. 4. If troubleshooting is unsuccessful or the issue is critical, follow established protocols for equipment replacement or escalation to biomedical engineering. 5. Document all actions taken and observations made. This systematic process ensures patient safety, regulatory compliance, and efficient problem resolution. Question 5. Benchmark analysis indicates that during the preparation of anesthetic agents, a critical step involves ensuring the correct medication is selected and prepared for administration. A certified anesthesia technologist is presented with a pre-filled syringe of a medication intended for a patient. Which of the following actions best demonstrates adherence to established pharmacology and patient safety protocols within the U.S. regulatory framework? Option A. Proceed with preparing the medication for administration based on the assumption that the pre-filled syringe is correctly labeled, as this is a common practice for routine medications. Option B. Independently verify the medication in the syringe against the patient's electronic medical record and the physician's written or electronic order, confirming the drug name, concentration, and dose. Option C. Use a medication that was recently administered to a similar patient undergoing a comparable procedure, assuming the dosage and type would be appropriate. Option D. Administer the medication based on a verbal confirmation from a circulating nurse who states they saw the physician order it, without independently reviewing the order. The correct answer is B. Independently verify the medication in the syringe against the patient's electronic medical record and the physician's written or electronic order, confirming the drug name, concentration, and dose. Explanation. Scenario analysis. This scenario presents a professional challenge due to the inherent risks associated with administering potent anesthetic pharmacology. The technologist must balance the need for effective patient care with strict adherence to safety protocols and regulatory guidelines. Misinterpreting or misapplying pharmacological principles can lead to adverse patient outcomes, including inadequate anesthesia, prolonged recovery, or serious physiological complications. The technologist's role requires a deep understanding of drug interactions, patient-specific factors, and the critical importance of accurate drug preparation and administration. Correct approach analysis. The correct approach emphasizes the technologist's responsibility to verify the prescribed medication against the patient's chart and the physician's orders, ensuring the correct drug, dose, and route of administration. This aligns with fundamental principles of patient safety and medication administration, as mandated by regulatory bodies overseeing healthcare professionals. Specifically, within the framework of anesthesia technologist certification in the U.S., this practice is underpinned by guidelines from organizations like the American Association of Anesthesiologists, ASA, and the Accreditation Association for Ambulatory Healthcare, AAHC, which stress the importance of the 5 rights of medication administration: right patient, right drug, right dose, right route, right time. This meticulous verification process is a cornerstone of preventing medication errors and ensuring patient well-being, directly reflecting the ethical obligation to do no harm. Correct approaches analysis. One incorrect approach involves proceeding with drug preparation based solely on verbal confirmation from a colleague without independent verification. This bypasses critical safety checks and introduces a significant risk of error. Ethically, this violates the principle of accountability and the duty to ensure patient safety. From a regulatory standpoint, it fails to meet the standards of due diligence required for medication handling, potentially contravening guidelines from the Food and Drug Administration, FDA, regarding drug administration and the Joint Commission's National Patient Safety Goals. Another incorrect approach is to assume the pre-filled syringe contains the correct medication without confirming its label against the physician's order. This overlooks the possibility of labeling errors, misfills, or expired medications. Such an assumption directly contradicts best practices in medication safety and regulatory requirements for accurate drug identification and preparation. It represents a failure to exercise professional judgment and adhere to established protocols designed to prevent catastrophic errors. A third incorrect approach is to administer a medication based on a previous patient's known drug regimen, even if the current patient's needs are similar. Patient care is individualized, and anesthetic requirements can vary significantly based on current physiological status, comorbidities, and the specific surgical procedure. Relying on past practice without current verification is a deviation from established protocols for safe medication administration and can lead to inappropriate dosing or drug selection, posing a direct threat to patient safety and violating ethical and regulatory mandates for personalized patient care. Professional reasoning. Professionals should employ a systematic approach to medication administration, often referred to as the 5 rights or 10 rights of medication administration. This involves a multi-step verification process, including checking the patient's identification, the physician's order, the medication label, the dose, the route, and the time of administration. In situations of uncertainty or ambiguity, the professional should always seek clarification from the prescribing physician or a qualified supervisor. This proactive approach, grounded in regulatory compliance and ethical principles, ensures patient safety and maintains the integrity of the anesthesia care team. Question 6. The audit findings indicate a recurring issue where pulse oximetry readings displayed on the anesthesia machine's integrated monitor occasionally differ significantly from those shown on a portable pulse oximeter used for spot checking. In such instances, what is the most appropriate immediate action for the anesthesia technologist to take to ensure accurate patient assessment? Option A. Perform a clinical assessment of the patient's peripheral perfusion and color, and if discrepancies persist, verify the reading using a different pulse oximeter or sensor. Option B. Prioritize the reading from the portable pulse oximeter, assuming it is more accurate, and document the discrepancy. Option C. Discontinue the use of the anesthesia machine's integrated pulse oximeter and rely solely on the portable device for the remainder of the case. Option D. Immediately recalibrate the anesthesia machine's integrated pulse oximeter and continue monitoring with it. The correct answer is D. Immediately recalibrate the anesthesia machine's integrated pulse oximeter and continue monitoring with it. Explanation. Scenario analysis. This scenario presents a professional challenge stemming from a discrepancy in patient monitoring data, specifically concerning pulse oximetry readings. The challenge lies in interpreting potentially conflicting information from different monitoring devices and determining the most reliable source of patient physiological data. Anesthesia technologists are expected to exercise critical judgment in ensuring accurate and continuous patient assessment, which directly impacts patient safety and the effectiveness of anesthetic care. The audit findings highlight a potential breakdown in this process, necessitating a thorough understanding of pulse oximetry principles and their application in a clinical setting. Correct approach analysis. The correct approach involves a systematic evaluation of the pulse oximetry readings, prioritizing the device that is most likely to provide accurate data based on established principles and clinical context. This includes considering factors such as the type of oximeter, the sensor's placement and integrity, potential sources of interference, and the patient's physiological status. Best professional practice dictates that the anesthesia technologist should verify the reading from the primary monitoring device by cross-referencing with other available data, including manual assessment of peripheral perfusion, and if necessary, utilizing a different pulse oximeter or sensor. This aligns with the overarching ethical and regulatory imperative to provide safe and effective patient care, as mandated by professional standards and guidelines for anesthesia technology practice within the specified jurisdiction. The focus is on ensuring the reliability of the data used for clinical decision-making. Incorrect approaches analysis. One incorrect approach would be to solely rely on the reading from the anesthesia machine's integrated monitor without further investigation, especially if there is a known history of artifact or if the reading appears inconsistent with the patient's clinical presentation. This fails to acknowledge the potential for equipment malfunction or interference, which can lead to inaccurate SpO2 readings and potentially delayed or inappropriate interventions. This approach violates the principle of diligent patient monitoring and could be considered a breach of professional responsibility. Another incorrect approach would be to immediately assume the patient is stable based on a single, potentially erroneous reading, and to disregard the discrepancy. This overlooks the critical role of continuous, accurate physiological monitoring in preventing adverse events. It demonstrates a lack of critical thinking and a failure to adhere to the standard of care that requires vigilance and verification of vital signs. A third incorrect approach would be to adjust anesthetic depth or administer medications solely based on the questionable pulse oximetry reading, without attempting to verify its accuracy or assess the patient's overall clinical status. This represents a direct risk to patient safety, as interventions would be based on unreliable data, potentially leading to oversedation or inadequate anesthesia. This approach is a clear deviation from best practices and could have serious regulatory and ethical consequences. Professional reasoning. Professionals should approach such discrepancies by first acknowledging the potential for error in any monitoring device. The decision-making process should involve a hierarchical approach to verification. 1. Assess the patient clinically. Observe for signs of hypoxemia or altered perfusion. 2. Evaluate the pulse oximeter. Check sensor placement integrity and for any visible signs of damage or dislodgement. 3. Consider potential sources of interference. Review the patient's environment and any concurrent procedures that might affect readings. E.g., patient movement, ambient light electrocautery. 4. Cross-reference with other data. Compare the SpO2 reading with heart rate, blood pressure, and end-tidal CO2 if available. 5. Utilize alternative monitoring. If doubt persists, use a different pulse oximeter or sensor, or consider manual assessment of peripheral pulse and color. 6. Document all findings and actions. Maintain a clear record of the discrepancy, the steps taken to verify, and the final assessment. This systematic process ensures that clinical decisions are based on the most reliable information available, prioritizing patient safety and adhering to professional standards. Question 7. Which approach would be most appropriate for an anesthesia technologist when preparing to administer opioid, sedative, and muscle relaxant adjunct medications as ordered by the anesthesia provider for a patient undergoing a surgical procedure? Option A. Administer the medications based on common practice for similar procedures, assuming the anesthesia provider's intent. Option B. Review the patient's chart for allergies and contraindications. Confirm the specific orders with the anesthesia provider, and prepare the medications according to the prescribed dosages and routes of administration. Option C. Select alternative adjunct medications that are known to be effective for the planned procedure, even if they differ from the provider's specific orders. Option D. Prepare and administer the medications as soon as they are ordered without further verification to ensure timely anesthetic induction. The correct answer is B. Review the patient's chart for allergies and contraindications, confirm the specific orders with the anesthesia provider, and prepare the medications according to the prescribed dosages and routes of administration. Explanation. This scenario is professionally challenging because the administration of adjunct medications like opioids, sedatives, and muscle relaxants requires a precise understanding of patient physiology, the specific pharmacological actions of each drug, and the potential for synergistic or antagonistic effects. The anesthesia technologist must anticipate potential adverse reactions and be prepared to assist the anesthesia provider in managing them, all while adhering to strict safety protocols and regulatory guidelines. Careful judgment is required to select the most appropriate adjunct based on the patient's condition, the planned procedure, and the anesthesia provider's orders. The correct approach represents best professional practice because it prioritizes patient safety and adherence to established protocols. It involves a thorough review of the patient's medical history, current medications, and allergies to identify any contraindications or risk factors for specific adjunct medications. Furthermore, it necessitates clear communication with the anesthesia provider to confirm the intended use, dosage, and route of administration of each adjunct, ensuring alignment with the overall anesthetic plan. This approach aligns with the ethical obligation to provide competent care and the regulatory framework that mandates diligent patient assessment and adherence to physician orders. An incorrect approach that involves administering adjunct medications without a clear understanding of their individual and combined effects poses significant risks. This could lead to unintended profound sedation, respiratory depression, or inadequate muscle relaxation, jeopardizing patient airway management and hemodynamic stability. Such an approach would represent a failure to adhere to the principle of do no harm and a violation of professional standards of care. Another incorrect approach would be to administer medications based solely on past practice or assumptions without confirming current orders or considering the patient's unique circumstances. This disregard for individual patient needs and current directives constitutes negligence and a breach of professional responsibility. It fails to acknowledge the dynamic nature of patient care and the importance of precise, Order-driven medication administration. The professional decision-making process for similar situations should involve a systematic evaluation. First, understanding the patient's baseline status and any pre-existing conditions. Second, thoroughly reviewing the anesthesia provider's orders for adjunct medications, including drug, dose, route, and frequency. Third, considering the pharmacological profile of each ordered medication and its potential interactions with other drugs or the patient's physiology. And finally, maintaining open and continuous communication with the anesthesia provider regarding medication administration and any observed patient responses. This structured approach ensures that all adjunct medications are administered safely, effectively, and in accordance with the patient's best interests and regulatory requirements. Question 8. The review process indicates that a newly installed anesthesia workstation features an integrated touchscreen interface, electronic vaporizers, advanced ventilation modes including pressure support and volume control, and built-in multi-gas analysis capabilities. Based on these characteristics, which of the following best describes this type of anesthesia machine? Option A. A specialized ventilator without anesthetic gas delivery. Option B. A modern integrated anesthesia workstation. Option C. A simple gas delivery device without integrated monitoring. Option D. A basic, older model anesthesia machine. The correct answer is B. A modern integrated anesthesia workstation. Explanation. Scenario analysis. This scenario is professionally challenging because the anesthesia technologist must accurately identify the functional characteristics of a specific anesthesia machine based on its design and intended use, which directly impacts patient safety and the quality of care provided. Misidentification could lead to incorrect setup, inappropriate use of features, or failure to recognize limitations, all of which pose significant risks in a critical care environment. The technologist's judgment is crucial in ensuring the machine aligns with the patient's needs and the planned anesthetic. Correct approach analysis. The correct approach is to identify the anesthesia machine as a modern, integrated system designed for versatility and advanced monitoring. This is best professional practice because such machines typically incorporate features like electronic vaporizers, advanced ventilation modes, integrated gas analysis, and digital displays, offering a comprehensive platform for anesthetic delivery and patient monitoring. This aligns with current standards of practice and regulatory expectations for advanced anesthesia equipment, ensuring the technologist can effectively operate and troubleshoot the device. The Anesthesia Technologist Certification exam emphasizes understanding the capabilities and limitations of various anesthesia machines to ensure safe and competent practice, as outlined in the examination scope and objectives, which focus on equipment knowledge essential for patient care. Incorrect approach is analysis. An incorrect approach would be to classify the machine as a basic, older model with limited functionality. This is professionally unacceptable because it demonstrates a lack of up-to-date knowledge regarding anesthesia technology, potentially leading to the technologist overlooking or being unaware of advanced features that could enhance patient safety or anesthetic management. Such a misclassification could also result in the technologist failing to utilize the machine's full capabilities or to recognize potential malfunctions specific to more complex systems. This directly contravenes the expectation that certified technologists possess current knowledge of the equipment they will encounter, as implicitly required by the certification's focus on contemporary practice. Another incorrect approach would be to identify it as a specialized ventilator without anesthetic gas delivery capabilities. This is professionally unacceptable, as it fundamentally misunderstands the primary function of an anesthesia machine, which is to deliver anesthetic agents and support ventilation. This misidentification would lead to gross errors in setup and operation, posing an immediate and severe risk to patient safety. It indicates a critical deficiency in understanding basic anesthesia equipment principles, which is a core competency assessed by the certification. A third incorrect approach would be to label it as a simple gas delivery device without integrated monitoring. This is professionally unacceptable because modern anesthesia machines are designed with integrated patient monitoring capabilities, e.g., capnography, oxygen monitoring, as standard. Failing to recognize these integrated features means the technologist might not utilize them, leading to a reduced level of patient surveillance and potentially missing critical physiological changes. This demonstrates a failure to appreciate the comprehensive nature of current anesthesia workstations, a key area of knowledge for a certified technologist. Professional reasoning. Professionals should employ a systematic approach when encountering unfamiliar or complex anesthesia equipment. This involves 1. Observing the machine's physical characteristics, including the presence of vaporizers, ventilators, monitors, and user interfaces. 2. Consulting available documentation, such as the manufacturer's manual or internal equipment logs, if time and situation permit. 3. Recalling or referencing knowledge gained during training and certification preparation regarding different classes and generations of anesthesia machines. 4. Prioritizing patient safety by erring on the side of caution and seeking assistance from experienced colleagues or supervisors if there is any doubt about the machine's identity or functionality. The decision-making process should always be guided by the principle of providing safe and effective patient care, adhering to established protocols and regulatory standards. Question 9. The analysis reveals that a patient scheduled for elective surgery has a history of regular use of St. John's wort, which is known to induce certain hepatic enzymes. The anesthesia care team is considering the use of propofol and a short-acting opioid for induction and maintenance of anesthesia. What is the most appropriate course of action for the anesthesia technologist to recommend to the anesthesia provider regarding this potential drug interaction? Option A. Recommend that the patient discontinue St. John's wort immediately prior to surgery without consulting the anesthesia provider, as this will eliminate any potential interaction. Option B. Advise the anesthesia provider to administer a higher dose of propofol and the opioid to compensate for any potential increased metabolism due to St. John's wort. Option C. Proceed with the planned anesthetic as St. John's wort is a herbal supplement, and its interactions with anesthetic drugs are generally considered minor and clinically insignificant. Option D. Inform the anesthesia provider of the potential for St. John's wort to induce hepatic enzymes, which may affect the metabolism and efficacy of certain anesthetic agents, and suggest a review of anesthetic drug choices and dosages. The correct answer is D. Inform the anesthesia provider of the potential for St. John's wort to induce hepatic enzymes, which may affect the metabolism and efficacy of certain anesthetic agents, and suggest a review of anesthetic drug choices and dosages. Explanation. The analysis reveals a scenario where a patient is scheduled for surgery and has a history of regular use of a specific medication known to interact with common anesthetic agents. This presents a professionally challenging situation because the anesthesiologist and anesthesia technologist must anticipate and mitigate potential adverse drug interactions that could compromise patient safety and anesthetic efficacy. Careful judgment is required to identify the specific interaction, understand its physiological implications, and implement appropriate management strategies. The correct approach represents best professional practice because it prioritizes patient safety by proactively addressing a known risk. This aligns with the fundamental ethical and regulatory principles of anesthesia practice, which mandate a thorough pre-anesthetic assessment and the implementation of evidence-based protocols to prevent harm. Specifically, it demonstrates adherence to guidelines that require the anesthesia care team to be aware of and manage drug interactions, ensuring that the chosen anesthetic plan is tailored to the patient's individual medical history and current medications. This proactive management minimizes the risk of unexpected hemodynamic instability, prolonged recovery, or other adverse events. An incorrect approach that fails to identify or address the potential drug interaction represents a significant regulatory and ethical failure. It violates the duty of care owed to the patient and could be construed as negligence. Such an approach neglects the requirement for a comprehensive pre-anesthetic evaluation, which is a cornerstone of safe anesthesia practice. Furthermore, it disregards established professional standards and potentially contravenes specific regulations that govern the administration of anesthesia and the management of patient medications. Another incorrect approach might involve administering the anesthetic without considering the interaction, relying solely on intraoperative monitoring to detect problems. This is a reactive rather than a proactive strategy and is ethically unacceptable. It places the patient at undue risk and fails to meet the standard of care expected of anesthesia professionals. This approach demonstrates a lack of due diligence and foresight, which are critical components of professional responsibility. The professional decision-making process for similar situations should involve a systematic approach. 1. Thoroughly review the patient's medical history, including all current medications, over-the-counter drugs, and herbal supplements. 2. Consult reliable drug interaction databases and pharmacological references to identify any potential interactions between the patient's medications and proposed anesthetic agents. 3. Evaluate the clinical significance of any identified interactions, considering the patient's overall health status and the planned surgical procedure. 4. Develop an anesthetic plan that either avoids the interacting medications, modifies dosages, or implements specific monitoring and management strategies to mitigate the risks. 5. Communicate clearly with the entire anesthesia care team regarding any identified interactions and the plan management. 6. Continuously reassess the patient's response to anesthesia and be prepared to adjust the plan as needed. Question 10. Governance review demonstrates a need to reinforce best practices for the selection and application of breathing circuits and patient interfaces during anesthesia. An anesthesia technologist is preparing for case and has several breathing circuit options and various airway interfaces available. Which of the following actions best ensures compliance with regulatory requirements and patient safety standards for this critical phase of anesthetic management? Option A. Proceed with the breathing circuit and airway interface that are most readily accessible in the operating room, prioritizing speed of setup over detailed verification. Option B. Utilize the newest model of breathing circuit available, assuming it offers superior performance, and select an airway interface based on the anesthesiologist's preference without independent verification. Option C. Select a breathing circuit that is generally compatible with the anesthesia machine model, and choose an airway interface that appears to be the most commonly used for similar procedures. Option D. Confirm the specific breathing circuit model is listed as compatible by the anesthesia machine manufacturer, and verify the selected airway interface is appropriate for the patient's planned airway management and anatomy, followed by a thorough pre-use check of all connections. The correct answer is C. Select a breathing circuit that is generally compatible with the anesthesia machine model and choose an airway interface that appears to be the most commonly used for similar procedures. Explanation. Scenario analysis. This scenario presents a professional challenge due to the critical nature of breathing circuits and interfaces in patient care during anesthesia. Ensuring the correct selection and configuration of these components directly impacts patient safety, ventilation efficacy, and the prevention of adverse events like barotrauma or misconnections. The technologist must navigate potential ambiguities in equipment compatibility and patient-specific needs while adhering to established protocols and manufacturer guidelines, all within the regulatory framework governing their practice. Correct approach analysis. The correct approach involves a systematic verification process that prioritizes patient safety and regulatory compliance. This includes confirming the compatibility of the breathing circuit with the anesthesia machine, verifying the correct interface, e.g., mask, endotracheal tube adapter, for the planned airway management, and ensuring all connections are secure and leak-free. This aligns with the anesthesia technologist certification's emphasis on safe patient care, adherence to manufacturer instructions for use (IFU), and the overarching principle of do no harm. The regulatory framework implicitly requires that all equipment used in patient care meets safety standards and is applied in a manner consistent with its intended use and the patient's clinical condition. Incorrect approaches analysis. An approach that bypasses verification of circuit compatibility with the anesthesia machine is a significant regulatory and ethical failure. This could lead to improper gas delivery, inaccurate monitoring, or even equipment malfunction, directly violating patient safety standards and potentially contravening guidelines on equipment integrity. Selecting an interface based solely on perceived ease of use without confirming its suitability for the patient's specific airway anatomy or the planned anesthetic technique is also a failure. This could result in inadequate ventilation, patient discomfort, or the need for rapid, potentially disruptive changes in airway management, all of which compromise patient care and deviate from best practices. Failing to perform a pre-use check of connections and integrity of the breathing circuit and interface introduces a risk of leaks or disconnections during anesthesia. This directly jeopardizes the delivery of anesthetic gases and ventilatory support, representing a critical lapse in the technologist's responsibility for patient safety and adherence to established protocols for equipment readiness. Professional reasoning. Professionals should employ a structured approach to equipment management, beginning with a thorough understanding of the patient's clinical status and the planned anesthetic. This should be followed by a meticulous review of available equipment, cross-referencing compatibility with the anesthesia machine and suitability for the patient. A critical step is the pre-use verification of all components and connections, ensuring they are intact, correctly assembled, and leak-free. This systematic process, grounded in regulatory requirements and ethical obligations, minimizes risks and optimizes patient outcomes. Question 11. The control framework reveals that an anesthesia technologist is monitoring a patient receiving a volatile anesthetic agent. The patient's vital signs are stable, but subtle signs of inadequate anesthetic depth are observed, such as slight movement and a rising heart rate. The technologist understands the drug's known pharmacokinetic profile regarding its elimination half-life and its pharmacodynamic effects on the central nervous system. Which of the following represents the most appropriate immediate action for the anesthesia technologist? Option A. Document the observed signs of inadequate depth, but wait for the anesthesia provider to initiate a discussion about potential adjustments. Option B. Alert the anesthesia provider to the observed signs of inadequate anesthetic depth and provide a concise summary of the patient's current status and the suspected cause related to the anesthetic agent. Option C. Administer a bolus of a short-acting opioid to counteract the signs of inadequate anesthetic depth without consulting the anesthesia provider. Option D. Increase the concentration of the volatile anesthetic agent independently to achieve the desired depth of anesthesia. The correct answer is B. Alert the anesthesia provider to the observed signs of inadequate anesthetic depth and provide a concise summary of the patient's current status and the suspected cause related to the anesthetic agent. Explanation. Scenario analysis. This scenario presents a professional challenge due to the inherent variability in patient responses to anesthetic agents, directly impacting pharmacokinetics and pharmacodynamics. Anesthesia technologists must anticipate and adapt to these variations to ensure patient safety and optimize anesthetic delivery. The challenge lies in translating theoretical knowledge of drug behavior in the body into practical, real-time clinical decisions without direct physician oversight for immediate adjustments, requiring a high degree of situational awareness and understanding of drug profiles. Correct approach analysis. The correct approach involves a proactive and informed assessment of the patient's physiological status in relation to the known pharmacokinetic and pharmacodynamic properties of the administered anesthetic agent. This includes recognizing subtle clinical signs indicative of drug effect, e.g., depth of anesthesia, muscle relaxation, hemodynamic response, and correlating them with the expected drug action and elimination. This aligns with the anesthesia technologist certification's emphasis on understanding drug behavior to support safe anesthetic practice, ensuring that interventions are timely and appropriate, thereby upholding the standard of care and patient safety mandated by regulatory guidelines. Incorrect approaches analysis. One incorrect approach involves relying solely on preset infusion rates or dosages without continuous patient assessment. This fails to account for individual patient variations in drug metabolism, distribution, and receptor sensitivity, potentially leading to under- or oversedation, inadequate anesthesia, or prolonged recovery. This directly contravenes the principle of individualized patient care and the technologist's responsibility to monitor and report patient responses, which is a core tenet of safe anesthetic practice. Another incorrect approach is to disregard or minimize observed patient responses that deviate from the expected profile, attributing them to non-pharmacological factors without further investigation. This demonstrates a lack of critical thinking and a failure to apply knowledge of pharmacokinetics and pharmacodynamics. Such an approach could delay necessary interventions, putting the patient at risk of adverse events due to unmanaged anesthetic depth or side effects. A third incorrect approach is to make independent, significant adjustments to anesthetic agent delivery based on assumptions rather than observed data and established protocols. While technologists are expected to be knowledgeable, their role is to support the anesthesia provider. Unauthorized or unverified adjustments can lead to unpredictable drug interactions or concentrations, violating established practice guidelines and potentially compromising patient safety. Professional reasoning. Professionals should employ a systematic approach. 1. Understand the drug's pharmacokinetic, absorption, distribution, metabolism, excretion, and pharmacodynamic drug effect at the site of action profile. 2. Continuously monitor patient vital signs and clinical indicators of anesthetic depth and response. 3. Correlate observed patient responses with the expected effects of the administered agent, considering patient-specific factors, age, weight, comorbidities. 4. Communicate any deviations from expected responses or concerns to the anesthesia provider promptly. 5. Be prepared to assist the anesthesia provider in making necessary adjustments based on the comprehensive assessment. Question 12. During the evaluation of a patient undergoing a routine surgical procedure, the anesthesia technologist observes a sudden onset of widespread urticaria, angioedema, bronchospasm, and a precipitous drop in blood pressure. The technologist suspects a severe anaphylactic reaction. Which of the following approaches best reflects the immediate risk assessment and management priorities for this anesthesia-related complication? Option A. Immediately administer intravenous epinephrine, secure the airway if compromised, and ensure adequate oxygenation and ventilation while alerting the anesthesiologist. Option B. Administer a bolus of intravenous antihistamines and bronchodilators to address the respiratory and dermatological symptoms. Option C. Focus on assessing for other potential causes of hypotension, such as hypovolemia or vasovagal response, before considering anaphylaxis. Option D. Begin documenting all vital signs meticulously and await further instructions from the anesthesiologist before initiating any interventions. The correct answer is A. Immediately administer intravenous epinephrine, secure the airway if compromised, and ensure adequate oxygenation and ventilation while alerting the anesthesiologist. Explanation. Scenario analysis. This scenario presents a professionally challenging situation because the anesthesiologist-technologist must rapidly assess a patient exhibiting signs of a potential anaphylactic reaction, a life-threatening complication. The challenge lies in the immediate need to differentiate between anaphylaxis and other conditions that might present with similar symptoms, such as vasovagal syncope or bronchospasm, while simultaneously initiating appropriate interventions. Prompt and accurate risk assessment is paramount to patient safety and requires a thorough understanding of both the signs and symptoms of anaphylaxis and the established protocols for managing such emergencies. Correct approach analysis. The correct approach involves a systematic risk assessment that prioritizes immediate patient stabilization and the administration of life-saving interventions based on the most probable diagnosis. This aligns with the anesthesia technologist certification regulatory framework's emphasis on patient safety, emergency preparedness, and the technologist's role in assisting the anesthesiologist. Prompt recognition of potential anaphylaxis and initiation of the ABCs airway, breathing, circulation, along with the administration of epinephrine, as per established protocols, represents best professional practice. This proactive and evidence-based approach minimizes the risk of morbidity and mortality associated with anaphylaxis. Incorrect approaches analysis. One incorrect approach would be to delay intervention while waiting for definitive diagnostic confirmation. This failure to act decisively in a suspected anaphylactic emergency violates the ethical obligation to prioritize patient well-being and the regulatory requirement for prompt emergency response. Such a delay could lead to irreversible harm or death. Another incorrect approach would be to administer medications other than epinephrine as the first-line treatment for suspected anaphylaxis, such as antihistamines or bronchodilators, without first addressing the immediate life threats. While these may have a role in later management, they are not the primary intervention for anaphylaxis. This deviates from established emergency protocols and demonstrates a lack of understanding of the pathophysiology and management of anaphylaxis, potentially leading to a worsening of the patient's condition. A third incorrect approach would be to focus solely on documenting the patient's vital signs without initiating any therapeutic interventions. While accurate documentation is important, it is secondary to the immediate need for life-saving treatment in a critical emergency. This passive approach fails to meet the professional responsibilities of an anesthesia technologist in an emergency situation and could be considered a breach of duty of care. Professional reasoning. Professionals should approach such situations by first recognizing the potential for a critical event. This involves a rapid assessment of the patient's presentation against known critical complications. The next step is to activate the emergency response system and alert the anesthesiologist. Simultaneously, the technologist should initiate basic life support measures and prepare or administer medications as per established protocols and under the direction of the anesthesiologist. This systematic, protocol-driven, and collaborative approach ensures that patient care is prioritized and that interventions are timely and appropriate. Question 13. Governance review demonstrates that during a complex neurosurgical procedure, an anesthesia technologist observes a subtle but persistent increase in the patient's somatosensory evoked potentials, SEP, latency, which deviates from the established intraoperative baseline. The technologist has confirmed the monitoring equipment is functioning correctly. Considering best practices for neurological monitoring and the technologist's role, which of the following actions best reflects appropriate professional conduct? Option A. Adjust the anesthetic depth or specific anesthetic agents independently to attempt to normalize the SEP latency. Option B. Continue monitoring without reporting the SEP latency changes, assuming the deviation is within acceptable physiological variation for the procedure. Option C. Document the SEP latency changes in the patient's record but wait to discuss them with the anesthesia provider until the end of the surgical procedure. Option D. Immediately inform the anesthesia provider of the observed SEP latency changes, detailing the deviation from baseline and the confirmation of equipment functionality. Correct answer is D. Immediately inform the anesthesia provider of the observed SEP latency changes, detailing the deviation from baseline and the confirmation of equipment functionality. Explanation. Scenario analysis. This scenario is professionally challenging because it requires an anesthesia technologist to interpret subtle neurological changes during a procedure and to act decisively based on their understanding of the patient's neurological status and the potential implications of anesthetic agents. The challenge lies in distinguishing between expected physiological responses to anesthesia and signs of emergent neurological compromise, necessitating a high degree of vigilance and accurate assessment. Correct approach analysis. The correct approach represents best professional practice because it prioritizes patient safety and adherence to established protocols for neurological monitoring. By recognizing the deviation from baseline, correlating it with anesthetic interventions, and promptly communicating these findings to the anesthesia provider, the technologist is fulfilling their responsibility to monitor the patient's neurological status and alert the team to potential issues. This aligns with the anesthesia technologist certification's emphasis on patient care and the technologist's role in supporting the anesthesia provider's assessment and management. Prompt and accurate reporting ensures that any necessary adjustments to anesthetic depth or management can be made in a timely manner, minimizing the risk of neurological injury. Incorrect approaches analysis. One incorrect approach involves dismissing the observed changes as insignificant without further investigation or communication. This fails to meet the standard of care for neurological monitoring, as even subtle changes can be indicative of developing problems. Ethically, this constitutes a failure to advocate for the patient's well-being and a breach of professional responsibility to report critical observations. Regulatory frameworks for anesthesia technologists mandate diligent monitoring and reporting of patient status. Another incorrect approach is to independently alter anesthetic delivery based on the observation without consulting the anesthesia provider. This oversteps the technologist's scope of practice, which is to monitor and report, not to independently manage anesthetic agents. Such an action could lead to unintended consequences, such as oversedation or inadequate anesthesia, and violates the hierarchical structure of the anesthesia care team. It also bypasses the critical judgment of the licensed anesthesia provider. A third incorrect approach is to delay reporting the findings until the end of the procedure or until explicitly asked. This delay can be detrimental, as neurological changes may require immediate intervention. It demonstrates a lack of understanding of the urgency associated with neurological monitoring and a failure to adhere to the principle of timely communication, which is paramount in patient care. This directly contravenes the expectation of proactive patient monitoring and reporting. Professional reasoning. Professionals should approach such situations by first establishing a clear baseline neurological status for the patient. When deviations occur, they must systematically assess the change, consider potential causes, including anesthetic agents, patient positioning, or other physiological factors, and then communicate their findings and concerns clearly and concisely to the anesthesia provider. This process involves active listening, critical thinking, and effective interprofessional communication, all of which are core competencies for anesthesia technologists. The decision-making process should always be guided by the principle of when in doubt, report. Question 14. The efficiency study reveals that during a simulated surgical procedure, an anesthesia technologist observes a capnography waveform exhibiting a distinct, prolonged, and sloped expiratory phase, often described as a shark fin appearance, while end-tidal carbon dioxide, ECO2 values remain within the expected range. Considering the regulatory framework for anesthesia technologist certification, which of the following interpretations and subsequent actions best reflects adherence to best professional practice and regulatory guidelines? Option A. Interpret the shark fin waveform as a normal variation in this specific patient's physiology and continue routine monitoring without any immediate escalation. Option B. Assume the waveform abnormality is due to a faulty sensor or tubing, and proceed to troubleshoot the equipment without informing the anesthesia provider. Option C. Immediately alert the anesthesia provider to the abnormal waveform, suggesting a potential for bronchospasm or airway obstruction, and await further instructions. Option D. Independently adjust the ventilator's inspiratory and expiratory flow rates to attempt to normalize the capnography waveform. The correct answer is C. Immediately alert the anesthesia provider to the abnormal waveform, suggesting a potential for bronchospasm or airway obstruction, and await further instructions. Explanation. Scenario analysis. This scenario presents a common challenge in anesthesia technology, interpreting capnography waveforms in the context of potential patient compromise. The professional challenge lies in accurately identifying subtle deviations from normal, understanding their physiological implications, and knowing when and how to intervene or escalate. Misinterpretation can lead to delayed diagnosis, inappropriate management, and ultimately, adverse patient outcomes. The requirement for absolute priority in adhering to the anesthesia technologist certification exam's regulatory framework means that all actions and interpretations must be grounded in established protocols and guidelines specific to this certification. Correct approach analysis. The correct approach involves recognizing the characteristic shark fin, or sloped expiratory phase of the capnogram, which is a hallmark of bronchospasm. This waveform directly reflects increased resistance to airflow during exhalation, a key physiological indicator of bronchoconstriction. Best professional practice dictates that an anesthesia technologist, upon observing such a waveform, should immediately alert the anesthesia provider. This aligns with the ethical imperative to advocate for patient safety and the regulatory requirement to report critical patient data promptly. The anesthesia technologist certification framework emphasizes the technologist's role in monitoring and reporting, not independent diagnosis or treatment, making immediate notification the most appropriate and compliant action. Incorrect approach is analysis. Attributing the waveform solely to equipment malfunction without further investigation or immediate notification to the anesthesia provider is a significant regulatory and ethical failure. While equipment issues can cause waveform abnormalities, assuming this without considering physiological causes, especially when a clear physiological pattern like bronchospasm is present, demonstrates a lack of critical thinking and adherence to patient safety protocols. This could lead to a delay in recognizing and treating a life-threatening condition. Interpreting the waveform as a normal variation and continuing routine monitoring without escalation is also a critical failure. The shark fin is not a normal finding and indicates a deviation from optimal ventilation and gas exchange. Failing to recognize and report this deviation violates the technologist's responsibility to monitor patient status and report significant changes, potentially leading to patient harm due to untreated bronchospasm. Focusing on adjusting ventilator settings without first confirming the cause of the waveform abnormality with the anesthesia provider is another regulatory and ethical lapse. The anesthesia technologist's role is to monitor and report, not to independently alter ventilator parameters, which are within the scope of practice of the licensed anesthesia provider. Such independent action could exacerbate the underlying problem or mask critical signs. Professional reasoning. Professionals should approach capnography interpretation with a systematic process. First, assess the baseline waveform for normal characteristics, e.g., rectangular shape, distinct alveolar plateau. Second, identify any deviations from the norm and consider potential physiological causes, e.g., bronchospasm, rebreathing, cardiogenic oscillations. Third, correlate waveform findings with other patient monitoring data, e.g., SpO2, heart rate, breath sounds. Fourth, and crucially, immediately communicate any significant or concerning findings to the anesthesia provider, adhering to established protocols for critical event reporting. This decision-making process prioritizes patient safety, regulatory compliance, and the collaborative nature of the anesthesia care team. Question 15. Regulatory review indicates that anesthesia technologists are responsible for ensuring the accuracy and reliability of physiological monitoring equipment used in patient care. If an anesthesia technologist observes an intermittent, unexplained fluctuation in a patient's end-tidal CO2 waveform on a capnography monitor during a procedure, what is the most appropriate immediate course of action to uphold regulatory compliance and patient safety? Option A. Immediately remove the capnography monitor from patient use, clearly label it as malfunctioning, and report it to the appropriate department for evaluation and repair according to institutional policy. Option B. Attempt to recalibrate the capnography monitor using the standard on-screen calibration function without consulting the manufacturer's manual or biomedical engineering. Option C. Continue monitoring the patient with the capnography monitor, but make a note in the patient's chart about the observed waveform anomaly. Option D. Disregard the waveform fluctuation, assuming it is a minor artifact, and focus on other monitoring parameters. The correct answer is A. Immediately remove the capnography monitor from patient use, clearly label it as malfunctioning, and report it to the appropriate department for evaluation and repair according to institutional policy. Explanation. Scenario analysis. This scenario presents a common challenge in anesthesia technology, ensuring the accurate and reliable functioning of physiological monitoring devices in a dynamic patient care environment. The challenge lies in balancing the immediate need for patient monitoring with the regulatory requirements for device maintenance and calibration. Failure to adhere to these standards can compromise patient safety, lead to inaccurate clinical data, and result in regulatory noncompliance. The technologist must exercise sound judgment to determine the appropriate course of action when a device exhibits potential malfunction. Correct approach analysis. The correct approach prioritizes patient safety and regulatory compliance by immediately addressing the potential device malfunction. This involves ceasing the use of the potentially faulty monitor and initiating the established protocol for device evaluation and repair. This aligns with the anesthesia technologist certification's emphasis on maintaining equipment integrity and ensuring that all patient monitoring is conducted with reliable instrumentation. The regulatory framework mandates that all medical devices used in patient care must be in proper working order, which includes regular calibration and prompt attention to any signs of malfunction. This approach upholds the ethical responsibility to provide safe patient care and adhere to established professional standards. Incorrect approach is analysis. Continuing to use the monitor while noting the anomaly without immediate investigation or replacement represents a significant regulatory and ethical failure. This directly contravenes the principle of using only properly functioning medical equipment. It risks providing inaccurate physiological data, which could lead to misdiagnosis, inappropriate treatment, or delayed intervention, thereby jeopardizing patient safety. This approach also fails to comply with guidelines that require prompt reporting and resolution of equipment issues. Attempting to recalibrate the monitor in situ without following the manufacturer's specific guidelines or without proper authorization from a qualified biomedical engineer is also a regulatory and ethical failure. While a technologist may have basic troubleshooting skills, complex recalibration often requires specialized knowledge and equipment to ensure accuracy and prevent further damage or miscalibration. Unauthorized or improper recalibration can lead to persistent inaccuracies, rendering the monitor unreliable and potentially unsafe for patient use. This bypasses established protocols for device maintenance and validation. Ignoring the anomaly and assuming it is a transient issue without any documentation or reporting is a critical failure. This demonstrates a lack of diligence and a disregard for the potential impact on patient care. It also violates the requirement for accurate record-keeping and communication regarding equipment status. Such an approach can lead to the continued use of a faulty device, with all the associated risks to patient safety and regulatory noncompliance. Professional reasoning. When faced with a potentially malfunctioning physiological monitoring device, a professional anesthesia technologist should follow a systematic decision-making process. This process begins with recognizing the potential issue and immediately prioritizing patient safety. The technologist should then consult established institutional protocols for equipment malfunction, which typically involve 1. Immediately removing the device from patient use. 2. Clearly labeling the device as out of service or malfunctioning. 3. Reporting the issue to the appropriate personnel, e.g., supervisor, biomedical engineering department. And 4. Documenting the incident thoroughly. This structured approach ensures that patient care is not compromised, that equipment issues are addressed systematically, and that regulatory requirements for device maintenance and patient safety are met. Question 16. Stakeholder feedback indicates a concern regarding the consistent and accurate delivery of anesthetic gases from a specific anesthesia machine's gas delivery system. As an anesthesia technologist, what is the most appropriate immediate action to address this feedback? Option A. Assume the system is functioning correctly as it appears to be in good working order. Option B. Perform a comprehensive functional test of the gas delivery system, including flow checks and alarm verification, in accordance with manufacturer guidelines and institutional protocols. Option C. Document the feedback and plan to address it during the next scheduled preventative maintenance cycle. Option D. Visually inspect the gas delivery system for any obvious signs of damage or disconnection. The correct answer is B. Perform a comprehensive functional test of the gas delivery system, including flow checks and alarm verification, in accordance with manufacturer guidelines and institutional protocols. Explanation. This scenario presents a professional challenge due to the critical nature of gas delivery systems in anesthesia and the potential for patient harm if not managed according to established standards. Anesthesia technologists must exercise meticulous judgment to ensure patient safety and regulatory compliance. The correct approach represents best professional practice because it directly addresses the identified stakeholder concern by initiating a systematic review of the gas delivery system's functionality and integrity. This aligns with the Anesthesia Technologist certification's emphasis on maintaining equipment in optimal working order to prevent adverse events. Adhering to manufacturer guidelines and institutional protocols for equipment checks and maintenance is a fundamental regulatory and ethical requirement for ensuring patient safety and the reliable delivery of anesthetic gases. This proactive stance minimizes the risk of equipment malfunction during patient care. An incorrect approach that involves merely observing the system without performing a functional check fails to address the root cause of the stakeholder's concern and neglects the technologist's responsibility to verify equipment readiness. This oversight could lead to undetected issues, violating the principle of ensuring a safe environment for patient care and potentially contravening regulatory mandates for equipment verification. Another incorrect approach, which is to assume the system is functioning correctly based on its appearance, is a dangerous assumption that bypasses essential safety protocols. Relying solely on visual inspection without functional testing is a significant regulatory and ethical failure, as it does not confirm the system's operational integrity and could result in the use of faulty equipment, jeopardizing patient well-being. A further incorrect approach, which is to delay addressing the feedback until a specific scheduled maintenance period, demonstrates a lack of urgency and a failure to prioritize immediate patient safety. Regulatory frameworks and ethical guidelines mandate prompt attention to potential equipment issues that could impact patient care, rather than deferring action based on convenience or routine schedules. The professional reasoning process for similar situations should involve 1. Acknowledging and validating stakeholder feedback. 2. Prioritizing patient safety above all else. 3. Initiating immediate, appropriate assessment and intervention based on the nature of the feedback and established protocols. 4. Documenting all actions taken and findings. 5. Escalating concerns if necessary. Question 17. Operational review demonstrates a patient undergoing a routine procedure suddenly exhibits signs of acute distress, including sudden onset of hypotension, bronchospasm, and urticaria. The anesthesia technologist recognizes these as potential indicators of anaphylaxis, which immediate action is most critical for the technologist to take to ensure optimal patient outcomes. Option A. Administer diphenhydramine and corticosteroids while awaiting physician assessment. Option B. Document the patient's symptoms in detail before taking any action. Option C. Initiate intravenous fluid bolus and monitor vital signs closely. Option D. Immediately administer epinephrine as per protocol. The correct answer is D. Immediately administer epinephrine as per protocol. Explanation. Scenario analysis. This scenario presents a critical challenge in an anesthesia setting where a patient exhibits signs of anaphylaxis, a life-threatening allergic reaction. The technologist must act swiftly and decisively, recognizing the urgency and potential for rapid deterioration. The challenge lies in accurately identifying the signs, initiating appropriate interventions within their scope of practice, and effectively communicating with the anesthesia provider, all while maintaining patient safety and adhering to established protocols. The pressure of a medical emergency demands precise knowledge and immediate, correct action. Correct approach analysis. The correct approach involves immediate recognition of anaphylaxis signs and prompt administration of epinephrine, the first-line treatment. This aligns with established anesthesia protocols and guidelines for managing anaphylaxis, which prioritize rapid intervention to counteract the systemic effects of the allergic reaction. Administering epinephrine directly addresses the vasodilation, bronchoconstriction, and laryngeal edema characteristic of anaphylaxis, aiming to stabilize the patient's cardiovascular and respiratory systems. This action is within the scope of practice for a certified anesthesia technologist when directed by the anesthesia provider or as per standing orders, reflecting best professional practice by prioritizing life-saving measures. Incorrect approaches analysis. One incorrect approach is to delay epinephrine administration while waiting for further diagnostic confirmation or to consult with additional personnel not directly involved in immediate patient care. This delay is a critical failure as anaphylaxis can progress rapidly, and any postponement of epinephrine can lead to irreversible shock or cardiac arrest. This violates the ethical imperative to act in the patient's best interest and the regulatory requirement to follow established emergency protocols. Another incorrect approach is to administer alternative medications, such as antihistamines or corticosteroids, as the primary intervention before epinephrine. While these medications may have a role in the later management of anaphylaxis, they do not provide the immediate life-saving cardiovascular and respiratory support that epinephrine offers. Relying on these secondary treatments first represents a significant deviation from best practice and regulatory guidelines for acute anaphylaxis management, potentially leading to adverse patient outcomes. A further incorrect approach is to focus solely on documenting the event without initiating immediate interventions. Documentation is crucial, but it must follow, not precede, life-saving actions. Failing to act promptly due to an overemphasis on immediate charting is a dereliction of duty and a direct threat to patient safety, violating both ethical and regulatory standards for emergency care. Professional reasoning. Professionals in this situation must employ a rapid assessment and intervention framework. This involves 1. Immediate recognition of anaphylaxis signs based on clinical presentation. 2. Swift activation of emergency protocols, including alerting the anesthesia provider. 3. Prompt administration of epinephrine as the first-line treatment, as per established guidelines and scope of practice. 4. Continuous patient monitoring and reassessment. 5. Accurate and timely documentation following the initiation of critical interventions. This systematic approach ensures that patient safety is paramount and that all actions are aligned with regulatory requirements and ethical obligations. Question 18. Implementation of infection control measures for reusable anesthesia breathing circuits between patient uses presents several potential approaches. Which approach most effectively ensures patient safety and regulatory compliance? Option A. Visually inspecting the circuit for gross contamination and storing it if no visible debris is present. Option B. Thoroughly cleaning the circuit according to manufacturer's instruction, followed by high-level disinfection using an FDA-cleared disinfectant and then proper storage. Option C. Wiping down the exterior of the circuit with an alcohol swab and storing it. Option D. Rinsing the circuit with sterile water and storing it for subsequent use. Correct answer is B. Thoroughly cleaning the circuit according to manufacturer's instructions, followed by high-level disinfection using an FDA-cleared disinfectant, and then proper storage. Explanation. This scenario is professionally challenging because the anesthesia technologist must balance the immediate need for equipment readiness with the paramount importance of patient safety and infection prevention. Failure to adhere to established protocols can lead to the transmission of pathogens, resulting in patient harm and potential legal ramifications. The technologist's judgment is critical in ensuring that all infection control measures are implemented effectively and consistently, even under pressure. The correct approach represents best professional practice because it aligns directly with established guidelines for reprocessing reusable anesthesia equipment, such as those outlined by the Association for the Advancement of Medical Instrumentation (AMI) and regulatory bodies like the Food and Drug Administration (FDA) in the United States. These guidelines mandate thorough cleaning, disinfection, and sterilization of equipment between patient uses to prevent cross-contamination. Adherence ensures that the equipment is safe for subsequent patients, minimizing the risk of healthcare-associated infections and fulfilling the technologist's ethical and professional responsibility to patient well-being. An incorrect approach involving skipping the high-level disinfection step before storage is professionally unacceptable. This failure directly violates regulatory requirements for reprocessing medical devices that come into contact with mucous membranes or sterile tissues. It creates a significant risk of pathogen transmission, as residual microorganisms may survive inadequate cleaning. Ethically, this constitutes a breach of the duty of care owed to patients. Another incorrect approach, relying solely on visual inspection for cleanliness without following a validated disinfection or sterilization process, is also professionally unacceptable. Visual inspection alone is insufficient to guarantee the absence of microorganisms. Regulatory frameworks mandate validated processes to ensure microbial inactivation. This approach demonstrates a disregard for established safety standards and exposes patients to preventable risks. A third incorrect approach, using a general-purpose disinfectant not approved for medical device reprocessing, is professionally unacceptable. Such disinfectants may not be effective against a broad spectrum of pathogens relevant to anesthesia equipment, or they could damage the equipment. Regulatory bodies and manufacturers specify approved disinfectants and cleaning agents for specific devices to ensure efficacy and material compatibility. Using an unapproved agent compromises both patient safety and equipment integrity. The professional decision-making process for similar situations should involve a systematic review of institutional policies and procedures, manufacturer's instructions for use (IFU) for all equipment, and relevant regulatory guidelines. When faced with time constraints or equipment shortages, the technologist must prioritize patient safety and infection control above all else. This may involve communicating challenges to supervisors, seeking alternative equipment, or advocating for adequate resources to ensure proper reprocessing. A thorough understanding of the risks associated with inadequate reprocessing is essential for making sound, safe decisions. Question 19. Risk assessment procedures indicate that a patient undergoing a surgical procedure will receive sevoflurane as an inhalational agent and propofol as an intravenous agent. Considering the patient's age and a history of mild obstructive sleep apnea, what is the most critical factor for the anesthesia technologist to proactively consider and communicate to the anesthesia provider to ensure optimal patient safety and anesthetic management? Option A. The need for increased sevoflurane concentration to achieve adequate anesthetic depth due to propofol's known amnestic properties. Option B. The likelihood of a prolonged emergence from anesthesia solely due to the patient's age, irrespective of the anesthetic agents used. Option C. The potential for synergistic respiratory and cardiovascular depression due to the combined effects of sevoflurane and propofol, necessitating close monitoring of respiratory rate, tidal volume, and hemodynamic parameters. Option D. The primary role of propofol in providing muscle relaxation, which will reduce the need for any specific monitoring of neuromuscular function. The correct answer is C. The potential for synergistic respiratory and cardiovascular depression due to the combined effects of sevoflurane and propofol, necessitating close monitoring of respiratory rate, tidal volume, and hemodynamic parameters. Explanation. Scenario analysis. This scenario presents a common challenge in anesthesia technology, managing the potential for adverse patient outcomes due to the interaction of multiple anesthetic agents. The professional challenge lies in anticipating and mitigating risks associated with the combined effects of an inhalational agent and a potent intravenous anesthetic, especially when patient factors like age and comorbidities are present. Careful judgment is required to select the most appropriate monitoring and intervention strategies to ensure patient safety and optimize anesthetic depth. Correct approach analysis. The correct approach which involves a comprehensive assessment of patient-specific factors and the anticipated synergistic effects of the chosen anesthetic agents, represents best professional practice. This aligns with the Anesthesia Technologist certification regulatory framework's emphasis on patient safety, risk management, and the application of knowledge regarding anesthetic pharmacology. Specifically, understanding the pharmacodynamics and pharmacokinetics of both inhalational and intravenous agents, and how they might interact, is crucial for anticipating potential complications such as respiratory depression, cardiovascular instability, or prolonged emergence. This proactive approach ensures that appropriate monitoring is in place and that the anesthesia provider is prepared to respond effectively to any adverse events, thereby upholding the ethical obligation to provide competent and safe patient care. Incorrect approach is analysis. One incorrect approach would be to solely rely on standard monitoring protocols without considering the specific combination of anesthetic agents and patient characteristics. This fails to acknowledge the potential for synergistic or additive effects, which could lead to an inadequate assessment of anesthetic depth or an unexpected delay in recovery. This approach violates the principle of individualized patient care and risk mitigation mandated by professional standards. Another incorrect approach would be to assume that the known safety profile of each agent individually negates the need for heightened vigilance when used in combination. This overlooks the complex interactions that can occur in vivo, potentially leading to unforeseen adverse events. Such an assumption demonstrates a lack of understanding of advanced anesthetic principles and a failure to adhere to the duty of care. A third incorrect approach would be to prioritize speed of induction or maintenance over a thorough understanding of the combined anesthetic effect. This could result in an anesthetic that is too deep or too light, leading to potential patient harm. This approach prioritizes expediency over patient safety, which is a direct contravention of ethical and regulatory requirements. Professional reasoning. Professionals should employ a systematic decision-making process that begins with a thorough patient assessment, including age, comorbidities, and any relevant physiological status. This should be followed by a detailed understanding of the pharmacological properties of all anesthetic agents to be administered, both inhalational and intravenous, and their potential interactions. The next step involves anticipating the combined effects on vital organ systems and determining the most appropriate monitoring modalities to detect any deviations from the desired physiological state. Finally, developing a plan for managing potential adverse events based on this comprehensive risk assessment is paramount. This iterative process ensures that patient care is tailored, safe, and compliant with all regulatory and ethical guidelines. Question 20. Process analysis reveals that an anesthesia technologist is preparing an anesthesia machine for a scheduled procedure to ensure optimal patient safety and adherence to regulatory standards. Which of the following actions best demonstrates a comprehensive pre-use assessment of the machine's critical components? Option A. Checking only the oxygen supply connection and the main power switch. Option B. Relying on the fact that the machine was recently used for another case and assuming it is fully functional. Option C. Performing a quick visual inspection of the machine's exterior for any obvious signs of damage. Option D. Confirming the integrity of the breathing circuit, verifying the correct placement and function of vaporizers, ensuring accurate gas flow meter readings, and testing the oxygen flush mechanism. The correct answer is D. Confirming the integrity of the breathing circuit, verifying the correct placement and function of vaporizers, ensuring accurate gas flow meter readings, and testing the oxygen flush mechanism. Explanation. Scenario analysis. This scenario presents a challenge in ensuring patient safety and regulatory compliance during anesthesia delivery. The core of the challenge lies in the technologist's responsibility to verify the integrity and functionality of critical anesthesia machine components before patient use. Failure to do so can lead to adverse events, including hypoventilation, hyperoxia, or delivery of incorrect anesthetic gas mixtures, all of which carry significant risks to patient well-being. The technologist must balance the need for efficiency with the absolute imperative of thoroughness, adhering strictly to established protocols and regulatory guidelines. Correct approach analysis. The correct approach involves a systematic, pre-use check of the anesthesia machine's essential components, focusing on their functional integrity and proper connection. This aligns directly with the Anesthesia Technologist certification regulatory framework, which mandates that certified technologists perform pre-anesthetic equipment checks to ensure patient safety. Specifically, this includes verifying the integrity of the breathing circuit, functionality of vaporizers, the accuracy of gas flow meters, and the proper operation of the oxygen flush mechanism. This methodical approach minimizes the risk of equipment malfunction during anesthesia administration, upholding the highest standards of patient care and regulatory compliance. Incorrect approaches analysis. One incorrect approach is to rely solely on visual inspection without functional testing. While visual checks can identify obvious damage, they do not confirm the operational status of internal mechanisms or the accuracy of delivered gas concentrations. This fails to meet the regulatory requirement for functional verification and significantly increases the risk of undetected equipment failure. Another incorrect approach is to assume that because the machine was used recently, it requires no pre-use check. Anesthesia machines are complex devices, and components can fail or become dislodged between uses. This assumption bypasses a critical safety step mandated by the regulatory framework and exposes patients to unnecessary risk. A third incorrect approach is to prioritize speed over thoroughness, performing only a cursory check of a few components. This demonstrates a disregard for the detailed protocols established by the Anesthesia Technologist certification guidelines, which are designed to ensure comprehensive safety checks. Such an approach is ethically unsound and directly violates the principles of patient advocacy and professional responsibility. Professional reasoning. Professionals should adopt a decision-making process that prioritizes patient safety above all else. This involves 1. Understanding and internalizing the specific regulatory requirements and guidelines for anesthesia equipment checks. 2. Developing and consistently applying a standardized pre-use checklist that covers all critical components. 3. Performing functional tests for each component to confirm its operational status and accuracy. 4. Documenting all checks performed and any anomalies identified. 5. Escalating any concerns or malfunctions to the appropriate personnel immediately. 6. Engaging in continuous learning and professional development to stay abreast of evolving equipment and safety standards.